You may have been trying to conceive a baby for months now, and it starts to affect your self-esteem, mood, and the quality of your intercourse. Or maybe you aren't trying at all, but you're just wondering about male infertility. Then this video is meant for you. We will cover all causes of male infertility, what to do about it, and some possible treatment options. My name is Raoul, I'm a medical doctor from the Netherlands, and it's my mission to medically educate you, my viewer, because educated people make healthier decisions. So make sure to watch the whole video so you don't miss any important information. And let's get started. Let's start with the bad news. First, unfortunately, infertility is very common, and about 1 in 7 couples is considered infertile. This means they had frequent, unprotected sexual intercourse for more than a year and weren't able to conceive a child during that period. In about 50% of these cases, male infertility plays at least a partial role. Having a baby sometimes seems so effortless, but in actuality, this is a very complex and sensitive process where a lot of things need to go right at the exact same time. Let's dive in a little deeper. A man must be able to produce healthy sperm. This is produced by the testicles under the influence of sufficient levels of testosterone and other hormones. Then the sperm must be transported to be mixed with semen, and during an orgasm it must be able to be ejaculated out of the penis. It's also important that a man makes enough sperm cells. If the number of sperm in your semen, which is called the sperm count, is too low, this decreases the odds that one of your sperm cells will fertilize your partner's egg. A low sperm count is considered fewer than 15 million sperm cells per milliliter of sperm or fewer than 39 million sperm cells in a single ejaculate. In addition, these sperm cells need to be healthy, functional and able to swim. Again, if a sperm cell is abnormal, it may not be able to reach or penetrate your partner's egg. Which brings us to some common causes of male infertility, all of which will interfere at one or more levels with the previously mentioned steps. One of the most common reversible causes of male infertility is a varicocele. This is swelling of the veins in the scrotum. Normally these veins will drain the blood from your testicles, but if there is an abnormal blood flow, this can lead to a reduced sperm quality and quantity. Next up is an inflammation of your testicles and/or epididymis. This can be caused by an autoimmune disorder or an infection, such as gonorrhea or HIV. Those can cause scarring in the tissue which produces, stores and transports sperm. This could permanently impact the sperm quality and quantity. Furthermore, conditions which can impact your hormone balances could also interfere with fertility. Examples of this group are certain tumors which affect your testicles or hormone-producing glands, or chromosomal defects like Klinefelter syndrome. In addition, certain medical treatments can also lead to infertility, for example surgery, radiotherapy, chemotherapy and certain drugs like steroid use. Other potential causes of infertility are ejaculation issues like retrograde ejaculation or defects in tubes which normally transport sperm, problems with sexual intercourse like erectile dysfunction or premature ejaculation, celiac disease, and having an undescended testicle. As mentioned, the potential causes of infertility are broad, and some of them are congenital. However, there are several risk factors which can further increase your risk. Overexposure to certain chemicals, pesticides and herbicides, overexposure to heavy metals, and overexposure to radiation or X-ray. The same is true for overheating your testicles. Frequent use of saunas or hot tubs may therefore temporarily impair your sperm count. And other risk factors are steroid use, usage of cocaine or marijuana, drinking too much alcohol, tobacco smoking, being overweight, sitting for long periods and wearing tight clothing. I hope you're learning a lot, and before we continue with some useful tips and tricks and some treatment options, I want to ask you to click the like and subscribe button. This will help out the channel tremendously, and in return you will get notified each week with a new awesome medical video. Thank you so much, it's free and you can always change your mind. So let's continue. Now then, maybe the most important question of the entire video. When should you contact your doctor? As might be obvious, the main sign of male infertility is the inability to conceive a child, even though you have had frequent, unprotected sexual intercourse for more than a year. This would be the best reason to contact your doctor. And depending on the underlying medical cause, male infertility might not cause any other symptoms, although there can be. Common symptoms can be difficulties with ejaculation, small volume of sperm, reduced sexual desire, erectile dysfunction, pain, swelling or a lump in your testicles, inflammation of your testicles, abnormal breast growth, the inability to smell, and decreased facial or body hair. If you do experience any of these, then please contact your doctor and he or she can help you to find out the extent of your symptoms. Which brings us to some useful tips you yourself can use to potentially increase your fertility. I want to add though that male infertility isn't always preventable. However, you can try to avoid some of the known causes of infertility. So, maintain a healthy weight and eat a healthy diet with plenty of fruits and vegetables. Don't smoke, limit your tobacco consumption and avoid illicit drugs. Minimize and manage your stress, exercise regularly, avoid lubricants during sex, and discuss the medication you're using with your doctor, as it might affect your fertility. And lastly, avoid prolonged seating during your job or during your day, and avoid STIs, as those can cause infertility. As mentioned, in some cases, male infertility isn't avoidable, and in those situations, it would be wise to contact your doctor so he or she can provide you with a suitable treatment plan. Furthermore, in these situations, it would also be wise for your female partner to visit the doctor as well to undergo testing. In those circumstances, potential treatment options can be surgery. For example, if you're dealing with a varicocele, it can often be surgically corrected. Or if certain tubes are obstructed, they can be surgically repaired. When dealing with a certain infection, for example an STI, your doctor can prescribe antibiotics to treat it. However, certain damage the STI has done to your genitals could be permanent. In addition, if you're dealing with erectile dysfunction or premature ejaculation, your doctor could prescribe certain medication to improve this. Next up, if your hormone levels aren't sufficient, your doctor might recommend hormone replacement medication. And the last treatment option could be ART, Assisted Reproductive Technology. ART treatment involves obtaining sperm, which depends on your wishes, but could come from normal ejaculation, surgery, or from a donor. This sperm could then be used to conceive a child. I hope you know now how male infertility is caused and what you can do about it, and most importantly, when to contact your doctor. If you have any questions, let me know in the comment section. And if you did learn something, please click the like and subscribe button. This will help out the channel tremendously, and in return, you will get notified each week with a new awesome video. For those of you that can't get enough, check out the playlist in the description or check out the TikTok, Facebook or Instagram at How to Medicate. I will see you there, or I will see you next week with a new video. Thank you so much. Bye bye.